Why do the villains always have crazy teeth? Konnichiwa, Dr. Braces here. Thank you so much for tuning in. Today we are going to look at some of the features and characteristics of the teeth of villains in certain popular programs. Fun fact, research shows that in job interviews specifically, a interviewer perceives someone with straight teeth as more intelligent and more trustworthy than someone with crooked teeth. And so if two candidates for a job line up the exact same and one has crooked teeth and one has straight teeth, they're almost always going to pick the one with the straight teeth. And so that probably plays into our little theme here today as to why in Disney movies and other type of shows do the villains always have crazy crooked teeth. So let's start by looking at some of the villains in one of the most popular shows, I think the most watched movie on Netflix, K-pop Demon Hunters. Now you might be saying, I've watched that movie, I didn't see anyone with crazy teeth. So we're gonna touch on the demons and their fanged teeth. Now everyone has fanged teeth. Those are called canines or cuspids. Cuspids are the sharp teeth in your mouth. You have two on the top, two on the bottom, and they're designed for biting and tearing teeth. Now, some people are born with naturally sharper cuspids than other people, and so it almost looks like they have fangs, but no one actually really has fangs like you see in the demons on K-pop Demon Hunters. But they do exist in all of our mouths, and that's a normal thing to have. Again, some people's are sharper than others. Sometimes I finish patients' braces and they ask me, can you make my fangs sharper? And it's something that a dentist can do. I don't recommend it if your fangs aren't naturally super sharp. I would recommend staying where you are and with what nature gave you. They're sharp enough still to do their function and what they're meant to do.
Why is that?
Why should you not sharpen them?
Yeah.
Because to sharpen them, you have to take a high-speed handpiece, so that's a dental drill, and you have to take that handpiece to the tooth and remove tooth structure to make it sharper. And so I don't personally like to remove natural tooth structure if I can avoid it. Next one, I like this one. This is Darla from Finding Nemo. A lot of people remember Darla because she goes into her uncle's dental office who has Nemo in the fish tank. He is going to give Nemo to Darla as a present, but she's already coming in with a fish in a baggie that's dead because she kills every fish he ever gives her. So she's kind of one of the like villains, I guess, in that story. And she comes in with braces and a headgear. So if you see a patient that's wearing a headgear, what orthodontists use headgear for is a condition called a class 2 molar correction. Class 2 means the upper molars are too far forward in relation to the lower molars. And so the headgear is designed, especially the one that she wears, it straps around her neck. And so you're using the back of the head as your anchor, and you're using the headgear to push those molars back so that they can line up into the proper position. It's a great treatment option for patients where the condition, it has to do with the upper jaw being too far forward. Sometimes patients with a class 2 condition, it's not because of the upper jaw, it's the lower jaw is set too far back. In that condition, you don't want to actually use a headgear. You want to do something to bring that lower jaw forward, and that makes the profile better. So it's important that the orthodontist in those situations is not just looking at the position of the teeth, but also looking at the soft tissue, the profile. If it's a lower jaw set back, you do not want to use a headgear. If the lower jaw is in a normal position, then it's more of a tooth problem, and you can use a headgear to drive that back. So that's why Miss Darla has a headgear in Finding Nemo. Most of the time, we recommend that patients wear their headgear for about 12 hours every day. Darla must be a very good patient because she is wearing it in daylight. Most of the time, people only wear their headgears at night, especially while they're sleeping. So if she were to wear it during the day, that would make it much more effective because the more you have it on, the faster it's going to work. Any questions on Darla?
No.
And headgear? All right, the next one is Sid from Toy Story. You may not even have noticed that Sid has braces, but as you notice in a lot of these shows, for whatever reason, the villains have braces. So Sid has braces. His teeth are kind of crooked. There's some gaps, there's some spaces. They're all kind of malformed because he's probably worn them down either from getting in fights or just chewing on bottle caps and things like that. Sid's teeth, in my opinion, it's going to be problematic for him his whole life because if you look at the braces, it looks like his hygiene isn't very good. So when they go to take the braces off, he's going to have cavities, he's going to have stains on his teeth, he's going to have a lot of different issues that are caused by his teeth, yes, but also from not taking care of his braces. So just remember, when it comes to braces, it's so important to keep the teeth clean. And if they look nasty and gunky and dirty, I guess you could fall in that category of a Disney villain. All right.
What are your feelings on villains having braces?
Villains having braces? I don't know. They're always little kids. I think that villains having braces, I mean, they're just doing whatever they can to make them look different, I guess. Make it more apparent that they are the bad guy. I don't know. I have a lot of patients that have braces, and they're some of the nicest kids I've ever met. I also have patients that would fall in the villain category that have their braces. So I wouldn't necessarily say just because you have braces, you're a villain. I don't think it's characteristic of villains. So I think that is a major misrepresentation by Disney by putting in, two of these patients that we touched on with braces are from Disney movies, and both of those patients are villains. Now, how about, you know what, one we didn't talk about? I loved this movie, both of them, because I felt like it really touched on what kids, especially teenagers, are going through, and that's Inside Out and Inside Out 2. So, do you remember the girl's name in Inside Out 2? Riley. So in Inside Out 2, Riley has braces. She is not a villain. She's actually very nice, right? And so that just goes to show you that just because you have braces doesn't mean you're necessarily a villain in a Disney show. Riley, I'm trying to think of her teeth. I don't have a picture of them here. I think they were crooked. And she would be a typical, let's put braces on. This is going to last maybe 12 to 14 months. Get these teeth straight, take them off. So she doesn't look like she had any bite issues, any profile issues, any soft tissue changes that needed to happen. More so just a dental tooth problem where you're straightening the teeth and not concerned so much about other things. Next one. Princess and the Frog, Raymond, Ray as I like to call him, the Firefly. So when you look at Raymond talk, when you look at him smile, he's missing a lot of teeth. That's usually the result of something called periodontal disease. Now what periodontal disease is, so it starts with something called gingivitis. That is simply an infection of the gums. That means someone is maybe not going to their dental cleanings, not brushing every day, not flossing every day. And so their gums are starting to get swollen, starting to get puffy. And that is gingivitis. The good thing, no, there's not anything good about gingivitis, but one of the positive things is gingivitis is only affecting the gums. It has not progressed to affect the bone that supports the teeth. But if you don't resolve your gingivitis and you let it continue to fester and get worse, eventually that infection will spread to the bones that support the teeth. Now, if you think about a tooth, it kind of looks like my arm down to my elbow here. The crown of the tooth, or the part that you see that comes out of the gums, would be my fist. And the rest of the tooth is the root, which is surrounded by bone. The bone tends to go right up to the crown of the tooth where the gums are. Now, if you get an infection in the gums and that spreads to periodontal disease, what happens is slowly over time, that bone will start to recede and resorb, and you get less and less and less tooth support, and then these teeth start to become mobile because they don't have enough bone, and eventually they have to be extracted or they fall out. So that is the condition that Ray has, is periodontal disease, and that is one reason why it is super important to go see your dentist every 6 months for your cleanings, because they're going to check, they're going to make sure that your gums are healthy, that you don't have gingivitis, and if you do, that they're taking care of it, getting those teeth clean and teaching you how to brush and floss the proper way. Now with braces, gingivitis is much more prevalent. Why is that? Because braces cover your teeth, and as you go in and you brush your teeth, the toothbrush cannot, because the braces are in the way, it does not hit along the gums. So if you're not spending extra time brushing along the gum line, you're much higher risk of gingivitis. Every orthodontist you go to is going to show you how to brush around the braces, how to keep the gums healthy and clean. But if those areas are neglected, then the gingivitis tends to spring up much more frequently in a patient with braces, because there's just hardware there. Things that are glued to your teeth, such as braces, that's a plaque trap. It's areas where bacteria can get trapped. And so if you're not keeping your teeth clean with braces, it's a much higher chance for gingivitis. So that's why we talked about that one with Ray. Even though he doesn't have braces, it's something that can happen with braces, and so you want to make sure you keep those teeth clean. On that note, if you want to know how your dentist or orthodontist knows how you haven't been vigilant in brushing and taking care of your teeth, click to the link on the left and Remember, smiles change lives, so keep smiling.